Baby blankets are now a thing of the past at Mercy Medical Center in Cedar Rapids. Instead, Mercy Birthplace is replacing them with baby sleep sacks. Now, some of you parents and grandparents like me might be wondering, what's a sleep sack? Well, it's actually a wearable blanket that's kind of like a baby version of a Snuggie. These sleep sacks zip up and have two wings that wrap around the baby's arms. And the whole point of this is to keep babies safer. KCRG TV 9's Chris Earl joins us live from Mercy Birthplace in Cedar Rapids tonight. And Chris, more specifically, these sleep sacks are meant to prevent sudden infant death syndrome, right?
That's exactly what the medical professionals are saying, Bruce. They're trying to stop those deaths from SIDS, dozens of them in Iowa each year. And this is a real movement from baby experts to try to take every item out of a crib, to get all the loose items out. And a loose blanket could be one of those loose items that can hinder a baby's breathing. Hospitals all seem to nearly be on board in almost unanimous fashion. All but 8 hospitals in Iowa are now sending babies home with the sleep stacks instead of the blankets, including both Mercy and St. Luke's in Cedar Rapids. A sleeping newborn brings that rare moment of peace for any parent, except for those moments when mom or dad will listen close to make sure everything is all right.
We check to make sure they're breathing a lot. A lot.
Valerie and Jason Faust of Cedar Rapids just welcomed their second daughter into the world on Monday, 7-pound Reagan. Yet as they're leaving Mercy Medical Center for home, instead of a blanket,
the sleep sack is all one piece, and there's 2 little wings that just wrap around the sides of the baby and keep them nice and safe.
Especially that last word, safe, is so critical. The fear of sudden infant death syndrome enters the mind of any parent at some point. Valerie has seen the tragedy before.
I actually just had a friend that their little 4-month-old just passed away a couple of weeks ago from SIDS.
Stopping this deadly but often unpredictable situation is why there will be less swaddling in the traditional blankets, even for Jason, the father, who his wife admits was a great swaddler for their first child.
Yes, and they fit right in there, and then the zipper goes down so that it's not irritating the baby, and it just folds right over.
This is the next step in keeping newborns safe and breathing. Like the push 20 years ago to put babies on their backs to sleep in a crib, now an empty crib is seen as a safe crib.
Stuffed animals, bumper pads all need to be removed because they can impede breathing and become a danger to a newborn or a young child.
Bruce, I'll admit here, it's been about 6 years since changing my last diaper, 7 since my last successful swaddle. But directions are inside of this sleep sack, and it does take a little bit of practice, but the Faust, that couple you just met, said that once they got the hang of it, it does help. It helps their little girl Reagan sleep really well, plus gives a little bit more leg room, a little bit more kicking, which, of course, very important for newborns, Bruce.
Chris, I'm wondering, how long should a baby be using these sleep sacks?
Well, this one that we have here goes up to 6 to 12 pounds. It's from birth to 3 months. And we went on to the website, which is a Halo Sleep Sack Swaddler, and they go up to 24 months, 36 pounds. So it can be very progressive, but for this one, for the newborns, up to 12 pounds. But all medical experts we talked to on this said they should be in something like this for the first year.
All right. Thank you, Chris. And here are a few other sleep safety tips for parents. A baby should always sleep alone in a crib, and as you heard in that story, without pillows, blankets, comforters, or stuffed animals or anything like that. Remember to keep the baby's face uncovered. Use a firm mattress with a tightly fitted sheet, and always place the baby onto his or her back and in the same sleep position each night.